The topic is a profile on CWyatt-Morley3, the founder of WOMEN. She's given us some information in reference to her last 17 years of work in an intimate fashion with this disease, and some advice as to what we might be able to do in order to successfully fight this disease. And of course, let's talk about some of the things. And I think that you quite recently received a grant. Let's talk about that grant and some of the things that you will be able to do with that, and then we'll say something about the support for what you're doing.
Yes, we were very successful in receiving a Centers for Disease Control grant recently, the latter part of 2010, and it was a phenomenal success for us. We're very, very excited. We're the only ones in the state of Tennessee to receive this funding. So with that, we are truly, truly blessed. But that opens up a large array of services for us. There are three components, three major components. Of course, there's subcomponents, but there's three major components with the grant. And one of them is to bring to the community a individual level intervention. And that is a one-on-one conversation about risk reduction, about what you need to do to protect yourself. And there are things that are also provided. There's condoms and safer sex kits and information, tons of information that are provided. And those are done in an intimate environment, in an intimate setting, and they're completely confidential. People can call the office and make an appointment. They can drop in anytime, and there's always people available to do a one-on-one conversation and counseling with individuals. So that's one of the interventions that we have. But then we also have a group level intervention, which is a larger intervention, which provides to the larger community in a group type environment, where we will be bringing educational themed parties, fun, exciting ways of learning about HIV, learning how to stay safe, learning how to protect yourself, and empowerment. So the group level intervention is going to be a lot of fun. It's going to be fun based, and we want to be able to take those into community centers, into on college campuses, and those types of things, where we can capture a larger audience, and it'll be a lot of conversation and a lot of feedback, and of course there'll be fun and food and music and games and all of that kind of thing. So we're really excited about our group level intervention as well. And then our third tier is always the HIV testing. We provide HIV testing, and we're certified through the state of Tennessee to provide HIV testing, and we'll provide those testings. We'll provide it in the group level, and we're also provided in a one-on-one setting. If somebody calls the office or comes to the office or lets us know that we want us to come to them, we'll do that. So our third tier is HIV testing. Again, as I said, it's very important that people know their HIV status. We just find that to be a critical thing. And then if someone is diagnosed HIV positive through our testing, what we do is link them immediately to care. We have a very large network that we use, so it's not that, okay, you're HIV positive and we just shoot you out the door. Absolutely not. I take time, if I'm there, because I travel a lot, but I take time with a person that is diagnosed HIV positive. We make sure that they are linked to the necessary resources. We are not an all-encompassing organization, nor are we trying to be, but we have a very large network by which we make phone calls immediately to individuals. We give individuals information immediately. When I was first diagnosed, no one gave me the initial information about what HIV was, how it affects your body, what's going to happen, what's next step. I didn't get all of that.
You're basically on your own.
Exactly, exactly. And we are determined to not let that happen. So we spend a lot of time talking to individuals. So our grant that we have been truly blessed to receive will provide us with tremendous work. And we're already making new partnerships. We're expanding old partnerships. And we're very, very excited about the service that we are blessed to bring.
And so you do find that the national administration and national situation is much more accommodating to what you're doing now in reference to AIDS than it was many years ago.
Yes, absolutely. The president, you know, has signed documentation for the first time in the history of the United States that is targeting HIV. He came up with a national strategy, a national HIV strategy, which is what it is, which helps to lay the foundation for what the White House is looking to at the challenges, how how to rectify those challenges, and then also bringing that down on a community level about how the community can get engaged in eliminating and reducing rates of infection as well.
I'm reminded that for a long time,